Assalamu alaikum dear students. Today we are talking about MDCAT test 2025 Anatomy MCQs Quick Revision Part 1st. Dear students, if you need MCQs for MDCAT test preparation, let me know in the comment section. डियर व्यूवर्स, अभी तक अगर आपने मेरा यूट्यूब चैनल को सब्सक्राइब नहीं किया तो जल्दी से सब्सक्राइब कर लें, लाइक और शेयर ज़रूर कर लें। शुक्रिया। All the cranial nerves are distributed to structures in the head and neck except option A 8th, B 12th, C 9th and option D 10th. So the correct option is D 10th, vagus nerve. Explanation is the vagus nerve is unique because its distribution extends well beyond the head and neck. It innervates organs in the chest and abdomen, including the heart, lungs, and most of the digestive tract. Dear students, subscribe now and press the bell icon. Never miss an update from a technologist. The nasal cavity is divided into two bony nasal septa, which are largely formed by option A palatine, B inferior conchi, C vomer, and option D lacrimal. So the correct option is C vomer. The nasal septum is composed of cartilage anteriorly and bone posteriorly. The bony part is primarily formed by the perpendicular plate of the ethmoid bone superiorly and the vomer bone is inferiorly. Dear students, this is very important MCQs. The connective tissue between the skull bone is called option A sutural ligament, B sutures, C fibrous joint, and option D temporomandibular joint. So the correct option is B sutures. Explanation is the immovable joint that unite most of the bone of the skull are called sutures. They are classified as fibrous joint, but the most specific anatomical term for the joint itself is sutures. Dash articulates with the scapula at the shoulder joint. Option A radius, B clavicle, C humerus, and option D ulna. So the correct option is C humerus. Explanation is the head of the humerus articulates with the glenoid cavity of the scapula to form the highly mobile shoulder joint. Dear students, this is very important MCQs. The upper end of the axilla is dash. Option A base, B root, option C floor, and option D apex. So the correct option is D apex. The axilla is pyramidal space. The upper part or apex is a triangular gap directed superiorly toward the root of the neck, abdomen, bounded by the clavicle, scapula, and the first rib. So, dash of the scapula it can be palpated easily in the living subject and marks the level of the seventh rib in the spine of the seventh thoracic vertebra. Option A superior angle, B inferior angle, C lateral border, and option D medial border. So the correct option is B inferior angle. The inferior angle of the scapula is the most inferior point of the bone and easily palpable. So it typically corresponds to the level of the seventh rib and the spine of the T7 vertebra. Dear students, if you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब, लाइक और शेयर ज़रूर कर लें। शुक्रिया। Dear students, this is the last MCQs. Disc axillary is formed by the skin stretching between the interior and posterior walls. Option A, base, B, root, C, floor, and option D, apex. So the correct option is A, base. The base of the axilla is the lowest part consisting of skin, subcutaneous tissue, and axillary fascia stretching between the anterior and posterior folds. Thank you for watching my videos.